It will run from 9 o'clock tomorrow morning until 9 o'clock on Thursday. This is a strike of the nurses union. 36,000 nurses and midwives going on strike for the 24-hour period. Their talks, negotiations with Health New Zealand have broken down. It's staff, not only the amount of staff, but what they're being paid. All Health New Zealand sites will be affected. Anne Daniels, president of the nurses organisation, is with me now. Anne, good morning. Good to have you here. Can you tell us how close or the average offer, is it above inflation?
No, it's not. Not in the slightest. And there's just not enough in the offer to keep our nurses in New Zealand. They're fleeing over to Australia in droves.
And so what is the difference? What's the average increase they're offering you versus what you want?
Well, the original offer was between 0 and 1%. And as we know, inflation is 2.7% right now, but it was much higher. And the whole nation knows how bad the cost of living is impacting on their ability to pay their mortgages, their rent, and put food on the table, let alone petrol in the car to get to work. So we need to have an offer that is going to actually keep nurses in New Zealand and also encourage people to take up nursing as a career.
Right, so more than 2.7% basically is what you're saying. What about your graduate nurses? Health New Zealand says 75 grand, they'll get an extra 11% by the middle of next year. That doesn't sound too bad.
No, it doesn't sound too bad, but the fact is that our new graduates are not being hired. And nearly 55% of the last cohort of new graduates were not hired, don't have jobs, and so are looking to Australia and overseas for jobs to pay off their loans and have the ability to live.
All of these things aren't making any sense to me, Anne, because you're saying the pay is too low and we need to attract more people, while at the same time, the graduates, there's not enough work for them, and so they're going overseas because we're not hiring. So how does all this shake down?
That's not correct, Ryan. There is a huge amount of work. We know this for a fact because the number of people who are trying to access hospital care through our EDs has risen by about 25% in the last year alone. The fact is that Te Whatu is not hiring because they're putting budget before people, and that means not only the nurses that need to be hired, but also the people that we care for. And ultimately, it is the patients that are suffering.
Right.
This is why we're striking.
Okay, so Anne, you said that there's been a 25% increase in patient admissions over the last year, is that right? What's the increase in...
No, accessing the hospitals. So because people are getting sicker because they cannot actually access GP preventative and early intervention care, they're ending up in the hospital. The numbers of people on waiting lists have risen by a huge amount. 68,000 people are on the waiting list. This is the reason why there are huge pressures on the hospitals, and this is why we need more nurses.
Right. So we need more, we're just not hiring them. That's what you're saying. I mean, Health New Zealand, this is the thing that gets me. Every time the union and the department have a go at each other, you come out and say one thing, they come out and say the opposite. It's black and white, and no one knows who's telling the truth. I mean, they're saying actually our replacement rates for nurses are the best it's been in years. Turnover in the nursing workforce decreased from 14% in December 2022 to 8.6% December 2024, which is good. They're saying that the average wage now for a registered nurse is more than $125,000, including penal rates and overtime, etc. It's a little confusing, to be honest, sitting in the middle of all this, Anne.
Yeah, there's a lot of misinformation there that you've just highlighted. The fact is that the $125,000 average pay means that a nurse has to work full-time night shift to actually get those kind of pay rates, and it's just not correct at all. Most nurses work part-time.
It is correct, it's just it comes with caveats. That's what you're saying.
huge caveats. Not all nurses work night shift. Not all nurses work full time. In fact, most nurses don't work full time because the huge workloads that we have to endure these days are absolutely exhausting. And so nurses are deliberately going part time to try and get some rest. They put everything they have every day that they go to work because they actually care about the patients. That's the job that they do. So, in terms of the numbers of nurses, the Te Whatu Ora own data actually states very, very clearly that nearly 50% of shifts are understaffed right throughout the nation. So their own data is saying that they are understaffed. So there's a lot of conflation and misinformation that is going out there to try and actually cover up their own facts. The fact is that we're going on strike for safe staffing. We need more nurses to provide good care where and when it's needed, and we need it now. And we've been fighting for this for a very long time. And it's time that Health New Zealand, Te Whatu Ora, actually did the right thing and had the ethical backbone to actually keep our nurses here, pay us what we're worth, and also ensure patient safety by having enough nurses where and when they're needed.
All right, and we appreciate you clearing that up for us this morning. That's Anne Daniels, President of the Nurses Organisation, and that strike will be taking place and affecting all sites that have Health New Zealand, Te Whatu Ora staff working there tomorrow from 9 a.m. for 24 hours. Nearly 4,500 surgeries and specialist appointments will be affected by this. So do check in with the hospital if you're concerned about an appointment you might have. Life-preserving services will continue, they say.